Hello everyone, my name is Juan Fernando Castro, and today I'll be presenting my evidence-based practice project titled Preventing Overweight and Obesity in New Grad Nurses Working Night Shifts. As we know, this project is part of our North 307 course, and I'm excited to share with you what I've learned about this important topic that affects both nurses' wellness and patient care. Background. As many as you know, working shifts, in night shifts especially, disrupts our natural circadian rhythms. This disruption leads to poor sleep quality, irregular eating patterns, lower physical activity, and increased stress. New graduate nurses are particularly vulnerable because they are adjusting not only to the profession but also to the demands of night work. This combination puts them at higher risk of developing overweight and obesity. Beyond the personal health effects, this issue impacts job performance, absenteeism, and burnout. My inspiration for this project came from both clinical observations and personal interest in promoting nurse wellnesses. During our 2 semesters, I've been able to speak with nurses and see dynamics, and I'm doing everything I can to create for myself a platform and a working dynamic where I don't fall down and burn out, and also I don't affect much my quality of life and my overall health. That's why I was inspired of sharing this with you guys, so also you can take care of yourself. It's a clinical problem. Currently, most hospitals in the DMV area and across the country don't have structured support systems specifically tailored for new grad nurses working night shifts. It's kind of the culture that the old eats the new or the young, and it's expected that if you are a nurse resident, do night shifts, holidays, and the shifts that no one wants to do. That means that there's often no consistent meal planning guidance, fitness opportunities, or education on sleep hygiene. This gap contributes to weight gain, increases stress, and eventually burnout. The problem, as mentioned before. I believe that the problem is more than personal health. It can end up affecting patients' care and leading to higher organizational costs due to absenteeism, turnover, and patient complications. Regarding the pickup question, to better understand the problem and possible solutions, I developed the following pickup question. P. New graduate nurses working night shifts. I. Structure lifestyle modifications programs. C. No structured lifestyle program. O. Reduced overweight and obesity incidence and improved lifestyle behaviors. T. During the first years of practice. So my EBP question becomes, in new graduate nurses working night shifts, how effective are structured lifestyle modification programs compared to no structured interventions in preventing overweight and obesity? I would love to hear your thoughts about this. Regarding to my searching strategy. To answer this question, I conducted a literature searching using several databases, including CINAHL, PubMed, the Cochrane Library, PsycInfo, and Scopus. The keywords that I used were night shift nurses and obesity, new graduate nurses and weight gain, and nursing and shift work and nutrition. That helped me a lot, actually. Then I filtered these results to the past 5 to 10 years, English language only, even though I also also did some reading in Spanish and Portuguese to better understand what was going on in Latin America. And peer review articles. Boolean operators help me to combine the Pico terms to refine the search. Summary of evidence. Actually, my review of evidence revealed several important findings. All in 2020 mentioned that stress peaks around 3 months into a new nurse role, which often results in poor self-care. They recommend early support programs. So again, my advice is 90 days. 90 days is the peak. O'Brien et al. In 2022 showed that low resilience combined with high stress lead to sedentary habits and weight gain. Again, resiliency and support systems is very important. Chen and Wu in 2023 found that night shifts nurses are 1.7 times more likely to be obese compared to day shift nurses. Blanco Yanez in 2021 reported that 67% of nursing staff were overweight or obese, with night shifts and poor diets being major contributors. Oliver in 2021 discussed how stress and weight stigma negatively impact self-care behaviors among student nurses. So even though all my analysis has been based in new grad nurses, I think that is something that we must pay attention to right now. And the strategies that we think that work for us, I would recommend to start implementing right now. That being said, this doesn't just affect our physical health as mentioned before. So we taking all this together consistently, we can see the studies consistently highlight the relationship between night shift work and weight gain, obesity, and even metabolic syndrome. When it comes to the practical significance, well, I believe that the takeaway is clear. Shift work increases the risk of obesity due to stress, poor diet, and disrupted sleep patterns. This doesn't just affect physical health, as I mentioned before, it also impacts mental health, staff retention, and ultimately quality of patient care, which translates in higher hospital costs and patient complications that can lead to death. The evidence points to structured wellness programs as a promising solution. But the literature shows that these programs are rarely implemented in real-world hospital settings. We'll see how is the DMV doing regarding this. The answer to our pickup question is, so what does this mean for our pickup question? And, after a lot of data analysis and reflection, I can conclude that structured lifestyle modifications programs are likely more effective than non-intervention in preventing overweight and obesity among new graduate nurses working night shifts. At the same time, or better say, however, we should be cautious. There's still a limited number of high-quality randomized controlled trials specifically targeting interventions for this population. More research is definitely needed. However, from the almost subjective and low experience perspective of me as a almost third semester nurse student, I believe that this is a matter of paramount importance and that it needs to be addressed as a priority. So its application to practice, this is when we can move from theory to practice, and I believe that this is how hospitals can use these findings. First, integrate wellness initiatives into nurse residency programs. Second, offer nutrition education sessions tailored to shift workers. Third, provide training in sleep hygiene strategies to help nurses adjust better to regular schedules. Fourth, create incentives for physical activity, such as gym memberships, fitness challenges, or group classes. And finally, provide stress management resources, whether through counseling, mindfulness programs, or peer support. I believe that all the self-care that we've been practicing and learning through nursing school is going to be very important, going to come handy for us when we start working, especially at nights. The expected outcomes include healthier nurses, reduced absenteeism, and better patient care and outcomes overall. Investing in nurses' wellness ultimately pays off in both human and organizational terms. Here are the references that guide my project. These studies provide strong evidence base and highlight the urgent need for intervention in this area. The bottom line is clear: supporting new graduate nurses during their transition, especially on night shifts, can have lasting benefits for their health and for the profession as a whole. Finally, I would like to say thank you for listening to my presentation. Thank you to my peers and my professor. Definitely, this is something that has opened my eyes and have helped me learn through this semester. So I'm confident that utilizing all these strategies, I can be a very professional and have a better care of myself. So again, thank you all for that. At the same time, I hope that this encourages more conversations about it and how can we better support new nurses, especially those working night shifts. I believe that promoting nurse wellness is just about preventing burnout and turnover. It's not about that just, but it's about creating a healthier workforce that can provide safer, more effective care for all our patients. I would be happy to take any questions that you may have, but I guess this is a conversation that is going to have to be placed in one-on-one setting in our class, or you can put it in the chat. Thank you again for listening. Bye-bye.